Hillsborough County, this is a fact that really tears at my heart, but we are leading the state of Florida in terms of all of its 67 counties in the number of babies that are born addicted to opioids. We cannot, that is totally unacceptable. 579 reported cases alone in 2015. This equates on average to 16 inpatient days and $66,700 per case, which totals $38.6 million in 2015 alone. And that number is going up. 1 in 10 people who need drug treatment today are not getting it. We know we have a limited number of beds in detox and a limited number of beds for longer-term residential treatment. In fact, the place that has the most detox beds is really in our jail, as our sheriff knows. And we know that more funding will help. But every dollar spent on treatment will save $4 in health care and $7 in law enforcement or criminal cases. Vast majority who have no income or low level or who are uninsured face long waits for beds here in Hillsborough County. And what that means is when they have to wait for a bed and say they overdose, get out of the hospital, and they're still waiting for a bed, that means they're back on the street, they're still using, and there's a potential of overdose or them going to jail or back to the emergency room again. So we need the help of this lawsuit of the manufacturers and distributors because we need to be able to provide the treatment we need. This epidemic has had a tremendous impact on the county as we try to respond to the epidemic. And we do not expect the taxpayers of Hillsborough County to foot the bill for paying for the solution to this problem. Within the Hillsborough County Health Care Plan, when extrapolated as an indicator of Hillsborough County's overall indigent population, we have seen annual rise in opioid-related costs by almost 900% since 2005. And these costs are projected to rise dramatically as this epidemic seizes our county over the next few years. As a community and as a county, we are getting aggressive to fight this. And to address the epidemic, Hillsborough County has completed a number of initial administrative actions to address this issue. And these actions include the following. In 2010, the Hillsborough County Board of County Commissioners enacted an ordinance to eliminate pill mills. We have a jail diversion project in behavioral health. We have co-located behavioral primary care services for Hillsborough County Health Care Plan recipients. We established the mental health drug court. We increased integration of social determinants such as housing for behavioral health expansion of intermediary beds. The Opioid Summit, implementation of outreach, access, and recovery programs. In April 2018, we expanded our Hillsborough County Health Care Plan up to 125% of the federal poverty level to include additional substance abuse and mental health treatment. Establishment of a behavioral health task force, which is emphasizing as its number one priority the opioid crisis. And we have proposed increases in funding for our 2019 budget that equate to approximately $10 million additional dollars to focus on prevention, treatment, education, and recovery. But we have to stay aggressive with this epidemic. And along with stakeholders in the county, we need to focus on these strategies. But that's why this lawsuit is so incredibly important. This is our county, our community. We work hard every day as public servants to make this the best county to live in, to work in, to enjoy the beaches and the sun and the great quality of life we have here. But this opioid epidemic is really putting a nick in that armor that we have, and we can't afford to let it keep going on. So I say this is a fight. We're going to continue the fight. I'm ready to fight, and I know everybody up here is ready to join in the fight. So with that, I'd like to introduce our next speaker, Mike Moore, who is the lead litigant for Hillsborough County on this issue.